welcome to the very first episode of Precision Educator Podcast. I'm Dr. Larry Chu, professor of anesthesiology at Stanford University, and I'm here with my colleague Viji Kurup. Together, we co-chair the Society for Education in Anesthesiology's Precision Education Task Force.
Thanks, Larry. We're so excited to launch this series. I'm Viji Kurup. I'm the Vice Chair for Medical Education at Yale and Professor of Anesthesiology also. We really have been talking about these concepts for some time now, and we really thought that this podcast might be a space for medical educators, faculty, and learners who want to explore how we can move beyond the one-size-fits-all education that we are so used to right now and tailor our learning experiences for each individual training.
Our goal in this podcast is to introduce the big ideas shaping what people are calling precision education. And our aim is to talk to experts, highlight innovations from programs across the country that are burgeoning in this new field, and to bring to our listeners real stories of how coaching, learning analytics, adaptive learning are changing the way that future physicians are being prepared using this new approach.
That's right, Larry. And I also hope that through this, we can create a community of educators who are curious and maybe who are all experimenting at their own institutions and who may want to learn together. So whether you're new to this concept or already building precision education projects, we hope this podcast gives you ideas, inspiration, and even some practical tools.
Absolutely. And in today's episode, we'll start with really the beginning, what precision education is and why it matters. Now, one of the first articles on this topic was written by Mark Trilla and Jesse Burke-Raffel in Academic Medicine a couple years ago. Mm-hmm. And they define precision education as a systematic way of using data and analytics to deliver the right educational intervention to the right learner at the right time.
That's such a powerful definition, Larry. But I do think that we want to explore what this means in real world terms. So how do you apply that idea in a residency program? How do you apply it in faculty development? And what challenges and opportunities does it create for people just like us?
Well, Viji, that is absolutely what this first conversation is all about. So let's dive in.
Perfect. So we've talked about why one-size-fits-all approaches don't serve today's learners. So let's shift gears a little bit and ask the big question. What do we actually mean when we say precision education, Larry?
So at its core, precision education is about using data in thoughtful ways to personalize the learning journey. So just like we've heard about precision medicine as approaches to tailor treatments to biology in the context of the individual person, precision education aims to tailor teaching and assessment to the needs and the goals of each learner. And one paper that described precision education talks about it as a systematic approach that brings together both longitudinal data and analytics to guide precise and timely interventions to create a continuous cycle of learning that supports the learner throughout their journey. Mm-hmm. And I like that because I think it emphasizes two things. So first, it's that we're not just talking about one-off fixes or interventions, but ongoing touch points throughout the journey based on feedback, based on data, based on analytics. And second, that the goal is to meet learners where they are and with what they actually need. So some authors have created a useful way to think about this. There's, of course, many, I think, different interpretations of precision education, but the one I think that has gone out there is something called the P4 framework, and it looks at precision education in the following ways: that education is proactive, it's personalized, it's participatory, and it is predictive. So take a look at those 4 P's as ways to implement, to actualize, to think about making education more precise for the learner. So the proactive part means giving feedback before problems become a crisis. Personalized means shaping the learning more precisely to fit the individual. And so for us as educators, that might mean really trying to figure out what type of learning a learner might respond best to, right? Participatory really highlights that learners are partners in this process. So it's not just us as educators trying to determine what is best for the learner, but it's an exchange of ideas and it's a process of collaboration. And predictive, of course, means using good analytics, good learning analytics and data to try to anticipate needs and guide and support learners through their journey. So stepping back a little, this isn't just about an individual success of a learner. Some authors are arguing that it ties directly to our social contracts as physicians, for example, that the way we assess and support learners should ultimately translate to better patient care and more equitable outcomes. So it becomes part of diversity, equity, and inclusion in healthcare as well. And that's a powerful, I think, reminder for why we need to engage in learning more about precision education and how we might be able to incorporate it into our practice. So with that, when you think about that definition, Viji, what feels most urgent for you for how we might train doctors today with that framework?
Yeah, so I really love the way you put it, the P4s, which is proactive, personalized, participatory, and predictive. So it really, I think, brought home all of these things that we had been thinking about. You and me, Larry, we've been thinking for a long time about how to fix the 2 Sigma problem. You remember that a few years ago, we participated in a panel together. Where we talked about how might we use the technology that we have right now to fix this age-old problem that we had of this, people or learners responding to personalized education. And I think now we are at the crossroads where we can actually implement it. And so the urgency, I think, comes from the fact that our traditional systems still rely very heavily on episodic exams and summative milestones. And our learners often don't know what they're struggling with until very late in this process. And so I think that having this precision education framework would flip that in favor of our learners by offering some continuous data-driven feedback, especially if it is in the form of dashboards that our learners could have access to and, almost create that adaptive learning platform that we had been talking about for a long time. So what do you think about that? About, these 4 elements that you talked about, the proactive, personalized, participatory, and predictive. Where do you see, in your experience, the biggest gap in our current systems?
I thought for many years, and I've given a few talks about it, and that my frustration has been that why is it that Netflix and Amazon can learn my preferences and predict what I want so well, but we don't have a similar technology to help educators understand the learning preferences and the needs of our learners. And I think that is a big gap that we could close because we have the technology. We just haven't applied it I do think some of the challenges are we haven't had maybe as much of the data that we maybe do now, but this is an opportunity. And I think we can take a lot from other fields and apply the predictive part of that 4Ps, especially with the emerging work in AI, natural language processing, large language models, to really help us advance that predictive element, to help learners on their journey in that personalization part, to predict the needs of learners before they reach a critical milestone point.
Yeah.
So that for me, I think the predictive part is really interesting.
Yeah.
I think it's a gap that we could close.
Mm-hmm.
I think we need to work together as a community to really look at that thoughtfully.
Yeah, I think that, that's actually something a lot of educators, I think, around the world are, currently thinking about. And it also ties in, Larry, with this idea of physicians having a social contract, right? Like we are entrusted by the public as educators to not just create competent physicians, but also compassionate and adaptable clinicians. And so I think, that expectation from society is something that we could probably now very realistically fulfill by linking our program evaluation to patient outcomes. Like, how are our learners doing in communicating with patients? What are their safety metrics? What are their equity indicators? Right? And now when we can take all of that and input it within the training program so that we can, fill these gaps that we've had for so long that we thought were unfillable. I think that's what makes, this so exciting for a lot of us. What do you think?
Absolutely. Absolutely. And I think there's a lot of these gaps that we're going to start to realize they're not so unsurmountable that we can really approach them. We have the means. We just haven't really thought through carefully how these new technologies, how the data that we have, that we already have, that's been growing, could be applied to try to solve some of these problems. But let's take this a step further, or maybe a step back. I don't know which. But let's really ask a more basic question, because there could be people listening to this podcast who are a little skeptical and are wondering, why not just keep doing what we have been doing? Because what worked for me, the one size fits all, the let's teach everyone the same way, worked for me. And I'm a great clinician today. So why do we even need precision education? What's broken with the current model?
So
what do you think?
Yeah.
What do we tell those people?
Yeah, I know. And this is not, it's not a theoretical question, because we do have these questions coming up in our, national societies when we meet each other. At my institution, we have a meeting of educators that we get together frequently and think about what are the problems we are facing in terms of both for our trainees as well as for our faculty. And that's one of the things that, comes up most often. And I think, the one size fits all has a lot of defects. Just as an example, let's just look at assessment, right? We give all students the same multiple choice exams, and the scores on that determine whether we accept people into fellowships, whether we let medical students come into a particular specialty of medicine. And yet, those scores really don't tell us much in terms of what is happening with these learners in terms of teamwork, what is happening in terms of their critical thinking, their clinical reasoning, right? And so there are studies now which are looking at all of this. They are looking at whether these multiple choice questions are the best way of assessing our learners. do narrative evaluations have better insights? But all of these, narrative assessments get lost in, the data noise that we have. So let me ask you a question. Do you think standardization still has a role in today's medical education?
Well, absolutely. I think that it's not going away. I think standardization is something that exists for a reason. In many ways, I think it helps to, if done right, it helps to ensure fairness, to help with comparability, especially you mentioned postgraduate fellowships, for instance. But precision education, I think, could be used, though, to add a layer of additional understanding, of additional personalization. And it's actually something that we're already doing, maybe not in as scalable ways, but we do high fidelity simulation, for example, to assess teamwork. And there could be additional ways, though, that we could implement newer technologies and more regularly, right? So not just once a year or not just in a high stakes milestone assessment, but more regularly during our everyday trainings. People are looking at simulation-based haptics in assessments so that we can actually look at how touch and palpation are used, for instance. And that's just one example. But I think overall, it's how can we add a layer to what we're already doing, not to replace.
Yeah.
So, but with that, I think, would it be useful, and maybe it wouldn't, but maybe we could think, are there examples where we could think through where one size fits all? Maybe that's not a good word for it because it feels a little limiting, but maybe where traditional medical education versus where you could take a layer on a precision education approach to that traditional education. Can you think of some examples?
That's like a, perfect question in terms of, yesterday I was just taking my resident through a thoracic epidural. And, I was just thinking about how we teach our trainees, to perform one of these epidurals, right? Like they either learn by a lecture or we have them practice on a phantom, and they're required to attempt so many epidurals in a thoracic OR and document that they've done these many techniques. And the feedback is usually binary. I got the epidural, I didn't get the epidural. The epidural worked, the epidural didn't work, right? And there's really no differentiation for those who need more anatomic mapping versus those who need better loss of resistance control, or somebody who has difficulty threading the catheter, right? And so we have these learners who have these different problems, but we kind of treat all of them the same. And our feedback is not as nuanced as it could be. And the further planning for what they could do next is not as granular as it could be. And so maybe if we were thinking of a redesign, we could have, we could decompose this epidural placement into like subtasks, from advance the needle from skin to the ligament angle, then go from the ligament to the epidural space. Then once you identify the space, advance your catheter. And in each attempt, you kind of figure out where is the learner struggling. Is the learner struggling in finding out the anatomic areas and advancing the needle? Or is it in, the skill level where you have to hold your needle and advance the catheter? And then we can actually, if the learners don't meet benchmarks in each of these subtasks, we can then focus on that. and maybe even have adaptive phantoms, right? You start with a standard anatomy, then gradually introduce challenging features. You could have somebody with scoliosis. You could have somebody with narrow interspaces. You could have somebody with calcified ligaments. So you could actually make these, different, progressively difficult, just different types of scenarios. And then doing, these small micro simulation modules after we've identified where the learner is struggling. So just taking my learner through this epidural, thoracic epidural yesterday, I was kind of going over all of these in my head and saying, how wonderful would it be if we could actually, break this one task into small micro tasks and then have a remediation almost for each learner that was directly related to their particular, skill level. And that would then make it actually more relevant for the learner than standard feedback, that we give for our learners. So that was something that just got me thinking yesterday.
Listening to your explanation, it resonates because it has face validity with me as an educator, because that I'm listening to you, I'm like, that's the way I'm thinking. That's the way as an educator I would walk someone through it. I break down a complicated procedure into different segmented tasks, right? But the difference is, and I think the beauty of your explanation is in how the learner is assessed and the feedback is given, right? So in all those ways that you described it, I would imagine many people, myself included, would say, you did a good job. You might consider doing this differently next time.
Yes.
But we would never go into the 5 or 6 or 7 different task segments that might need individual improvement. They would get the one thing. We would tell them the 1 or 2 things. And so for the learner, they're not getting the maximum learning that they could be getting from the feedback. And what I like from your example, and I think why it makes it a precision education redesign, is the idea that you're collecting data and you're collecting it in a way that is standardized so that if we can all agree on how to break down the placement of a thoracic epidural into different tasks, maybe skin wheel, maybe, as you said, the skin to ligament angle, the depth of the epidural placement, then we can start talking about the same language to give feedback, the same language to create like a progression, right, of your skill development, and then help educators to start to talk and share with the same language. It doesn't mean, because I think the other thing that when I first started learning about precision education, I think there was maybe a thought that we would all have to start teaching the same.
Yeah.
And not only is it a standardization of terms, but now we'll all have to teach the same, and all the modules will be the same, and it's the same. But I think what this does, though, is give us the freedom to create our different approaches,
Right.
Because it's personalized. But we have to have some shared vocabulary, and I like that idea that you just gave, because it has surface validity for me, and it makes sense, and that I think drives home the reason why we need this approach to give a voice to what we're already doing. We're just not maybe doing it as precisely as we should. All right. So maybe this is a good time to talk about where precision education is already showing up, or maybe examples where we might already see it has potential. So this is maybe a question, and we have to recognize that the concept of precision education is very new. So with that in mind, I'll ask you, Viji, do you have any thing you've seen, any programs, or even any concepts or ideas that you think really could embody precision education? I know you just gave me this idea of a thoracic epidural, but is there anything bigger that you are thinking about?
Yeah. So remember at our Society for Education and Anesthesia task force that we both co-chair, at the last meeting, we had so much excitement among the members who showed up for that task force meeting. And a lot of them talked about some of the, projects that they have going in their own, in their own institutions. And I know that, some of the programs use the, information from your electronic health record, and they then correlate what is, and I know that you've done some work on this, where you kind of take what cases the residents are having the next day, and then, get some, a short, almost like a write-up, or point them to information related to that case that goes out to the residents. So it is just in time, right? So when we're talking about, precision education, we're talking about the right knowledge going to the right learner at the right time. And I think that kind of, hits home for me, that, and we do this informally many times, like we ask them questions when we have residents call us the previous evening. We point them to, either guidelines or articles that we think would be relevant to the next day. But doing this systematically and doing this for all learners, right? I think that can really make precision education a real thing for for our learners, and it is doable, right? All we have to do is to link our electronic health record to databases that we have, that we point our residents to for their learning. And I know that you did that for some time for your residents.
That is a project that we are piloting at Stanford. We have access to the Epic case procedure, so we know which cases residents are doing the next day, as well as which cases they have done historically. So we not only know the case gaps, but we can create a procedure learning map and see what are their learning needs. And one of the things that we are working on to pilot is to send them the society guidelines or clinical updates for the learning map for the cases they're doing the next day, and see the impact that might have on implementing the best practices.
And I think that there's also some data in literature on places like Vanderbilt and NYU, who are using, some mode or some parts of this framework to make it better for the learners.
Absolutely. I know that Vanderbilt has some form of aggregation of longitudinal data of their assessments that they provide back to their students for personalized feedback. And NYU has a very robust effort in precision education, and they're using AI in some forms to analyze notes and generate feedback. So burgeoning areas, but all showing some very interesting and promising efforts.
Absolutely.
So, I think with that, it might be important to also discuss challenges and opportunities for precision education. Because as much as we've talked about that it has promise, that it's very interesting to implement these new technologies, there are people who express some concerns, or there are challenges around the use of data. Maybe it's time that we kind of discuss a little bit about what are some of these barriers that may stand in the way of implementing precision education.
Yeah. And I think...
What do you think might be the biggest barrier?
Absolutely. I think there are a lot of barriers, and this also came up again at the, meeting that we had, our kickoff meeting at the SEA. And one of the things that I feel our faculty are really concerned about is that they really lack time to process all of this, large amounts of learner data. So one is in terms of time, right? Faculty are being pushed for productivity. We recently did a survey of the anesthesiologists in Connecticut as part of our, Connecticut State Society of Anesthesia survey. And informally, I can tell you that when we discuss the results, one of the biggest things that our faculty are concerned about is their the productivity parameters that are coming as a barrier between, their teaching and, making sure that we are safely taking care of sick patients, right? So the productivity pressures are really high for faculty. And so one of the things is in terms of time, in terms of bandwidth, and in terms of expertise, right? Like if you want faculty to make sense of all of this data, they also need a little bit of training in terms of expertise to figure out what is it that they're seeing and how can they make sense of all of the data and be able to take what they need to make sure that they can best serve their learner for that day. So I think that, in all of those are the things that are, I would feel are barriers to this wide scale implementation of precision education, because although all of these things sound wonderful, implementation of it is, always takes time and effort. And most of that effort is, the initial effort, right? Where you want to create these dashboards, where you want to, federate all of these learning objects that you have. So all of those are initial work, but the, sometimes people are just, stupefied by the enormousness of this data that is out there. And I think breaking it down to simple forms, creating collaborations between our colleagues in biomedical engineering, in computer science engineering, and our faculty, I think would be key in making sure that we can actually execute on all of the ideas that we have. Do you have similar issues with what do you think is, about this?
Well, for me, I think a challenge that we probably don't talk about enough are ethical areas.
Mm-hmm.
And I think it is an area that will take some scholarship and some collaboration.
Yes.
To work out. So I think ethics in terms of how learner data is used to deliver personalized learning. Who owns? So if I am a resident, if I am a learner, who owns my data?
Yeah.
How is my data used? How long is my data kept?
Yes.
And can it be sold? If I move to a different program or a fellowship program, is that data shared?
Mm-hmm.
So that, once we get to the level of how long it took me to place a skin wheel for a thoracic epidural last Thursday with Dr. Kurup,
yeah,
there are questions about how people will use the data. So I think there are these type of questions that need to be resolved. And with that, I think also in the same amount, in the same theme of ethics, bias.
Yeah.
Bias is also a concern. And we know, for instance, that artificial intelligence can be biased because if AI is trained on biased data, for instance, it can reinforce inequities. So part of it is we want to have some assurances or some mechanisms for understanding how the data is collected and what biases there are right? There are all the time. I mean, who's so for instance, I'm just kind of being facetious, but if we were ever in this position where we're measuring how long it takes to put in a skin wheel, who's measuring that?
Right.
And are there any biases in measuring that time? Could that affect my future career?
Mm-hmm.
So these are the complexities that come into play when we start to collect larger and larger amounts of data. And maybe we're not thinking about that yet, but I think there will come a time where it's important to start to think about some of these. And maybe not even objective data, but what about narrative data and biases, written comments? Right. And how do those written comments then become part of the workflow to personalization, right? And how are they actualized, right? So how do we convert narrative comments using AI into personalized feedback? And how does someone's written comment about me affect me later? And how does AI use those?
Yeah.
Especially if people's narrative comments could be biased.
Absolutely.
Yeah, it's a big ethical
issue. I know. And really, I feel precision education can either narrow or widen gaps, right? If it's done well, it ensures that each learner gets the support they need when they need it. But when it's done poorly, it risks reinforcing privilege, right? And so, participatory models that involve the learners and communities can help keep, equity front and center every time we are making these models. So how do we make sure that precision education promotes equity rather than reinforce the biases that already exist in our society?
You've mentioned that a few times during this podcast. I love that you have. And I think it's something that doesn't really get a lot of discussion when people talk about precision education, equity, and you use the word social contract. Both of those words, I think, are so important. I think we have to think about those two words and how we consciously incorporate equity and social contract into our efforts around precision education. One thing that I've always done in my work with Medicine X and other efforts in inclusion is to try to be as broad as possible in inclusion and involving people in your design,
right,
in your planning as early as possible, and not just creating something and then inviting the end user in and saying, hey, I did this thing. Don't you like it?
No.
And so I think for precision education, we are in the early days, and now is a good, perfect time to be cross-disciplinary, to invite in learners, patient advocates, educators, technologists. This is the time to bring everybody to the table to talk about what we're doing so we can really see what the impact might be. When you bring in members of the community, when you bring in the end users of the education, the learners, when you bring in the educators themselves, then you can start to see how the tools that you build might shape the efforts. And I think it's important to have the diverse voices at the table. I think it's the beginning, it's the start. It's not the end. And it's an ever-evolving process that requires deliberate practice.
Right, absolutely.
So let's maybe wrap up with a view of the future. Because this is all really exciting. We're at the beginning here. And so maybe it's too early to think about where this is all going. But I want to challenge you to think about that a little bit. So if you could design one precision education tool for the future, what would it be in 2025? If you're going to design one precision education tool for the future, what would it be?
Yeah, and this is something I've been thinking about, for a long time. And, we thought that I never really thought it would take so long for us to do this. And why can we not have a dashboard for our learners, right? So we have the data about the types of, you know, patients they see, what cases are they involved in, what are the patient outcomes, what are their standardized test results, how have they done in their simulations. We have all of this data, but they're all in different areas. And it's really like we haven't put all of them together. So if I could, design one tool, mine would be a real-time coaching dashboard for our learners that integrates everything, their clinical performance data, the feedback from their peers, any assessments that we're doing for them, and their patient outcomes. So the learners can see where they are and where they need to go. And faculty can also guide them more effectively and efficiently, taking a look at this data. So, I really do think that precision education isn't just about making better doctors, but it's also fulfilling our profession's responsibility to patients and the society, right? Like we go back to the social contract and making sure that we fulfill the obligation that we have towards society when they have entrusted to us the care of the future, physicians. And so we now have all of the technology we need to make this a reality. It just needs more of us to bring all of that together and to make sure that we can do this, for our future.
Yeah, absolutely. I think that would be I want to see that. Where is that?
Yes, exactly.
I think that is a very noble and important goal. Mm-hmm. And I'd love to see the patient voice in there somewhere too, though I think you did mention it, but
right. And you were one of the
I think patients often don't see the end point, or they don't see the process of education. And I wonder if they could.
Right. And they should.
Or be involved in some way.
Right.
Because and I wonder, what would that look like?
Absolutely.
How would that look?
Yeah. The ultimate, beneficiary of all of this is the patient. So if we don't get this right, the people who suffer is going to be the patients. And so having their voice while we are developing all of this, I think is absolutely essential and central to what we are doing.
Well, I think this is a good time to wrap up. You have been listening to The Precision Educator, where we aim to explore how data, coaching, and innovation can transform the way we teach and learn in medicine. This has been our first episode, one of many. And our goal is to help you, our listener, move beyond one-size-fits-all education towards approaches that are proactive, personalized, participatory, and predictive. If you have enjoyed today's conversation, please subscribe and share the podcast with your colleagues. And if you'd like to join the movement, connect with us in the Society for Education in Anesthesiology Precision Education Task Force. Until next time, I'm Dr. Larry Chu.
And I'm Viji Kurup.
And this has been The Precision Educator, personalizing learning, transforming medical education together.
Until next time.